Press your thumb against your index fingernail right now. Hold it. 3 seconds. Now release and watch. If that pink came rushing back in under 2 seconds, that's a good sign. If it came back slow, uneven, or barely at all, you may have just caught something your last 3 doctor's appointments completely missed. I'm Dr. Michael Kent, and what you just did with your thumb, that's one of 8 things your nails are telling you right now. 8 signals, 8 different organ systems, your heart, your liver, your kidneys, your lungs, your blood vessels talking every single day, whether you're listening or not. But before we go through all 8, I need to tell you about Dolores. Dolores was 67 years old, active, independent, no major health complaints. For 8 months, her nails looked slightly off. She couldn't describe it exactly. Nothing dramatic, nothing you'd notice from across the room, but she knew something had changed. She brought it up at 2 separate doctor's appointments. Both times she heard the same thing, probably just age. She left both appointments with no answers and a feeling she couldn't shake. When Dolores finally came into my office, I spent 4 minutes looking at her hands. 4 minutes. What I saw sent her for blood work that same afternoon. Stage 2 chronic kidney disease, caught early enough because of what was written on her nails to potentially keep her off dialysis for the rest of her life. What I saw on Dolores's hands has a name, and you'll be able to recognize it on your own hands in about 3 minutes. But first, sign number 1. Look at your nail right now under good light, natural daylight if you have it. A healthy nail is mostly pink. The blood-rich tissue beneath the nail plate shows right through it. Small white crescent at the base, your lunula, that's all normal. Terry's nails look completely different. The nail goes almost entirely white, milky, opaque, like someone drained the color straight out of it. There's only a thin strip of pink left right at the very tip, just the edge. This was first documented in 1954. A physician named Richard Terry found it. He found it in 82 out of 100 consecutive patients with liver cirrhosis. 82 out of 100, that's how strong that association is. Research in The Lancet later confirmed links to congestive heart failure, chronic kidney disease, and type 2 diabetes. And here's what you need to understand. Terry's nails can show up years before jaundice, years before pain, years before any symptom most people connect to liver or heart disease. The nail signals first. If you're seeing this on your hands, photograph it right now on your phone with today's date. You're building a visual timeline. Bring it to your physician because combined with what we're about to cover, the picture becomes undeniable. Sign number 2, and this is what Dolores had. Half and half nails, also called Lindsay's nails, and they look exactly like the name says. The half of the nail closest to your finger, white, pale, drained. The half toward the tip, noticeably darker, pink, red, sometimes brownish. A clean line between the 2 zones, visible in good light. Research in peer-reviewed nephrology literature has consistently linked this pattern to chronic kidney disease, not as a late finding, as a finding that can appear months before obvious kidney symptoms ever show up. Now, the difference from Terry's nails matters. In Terry's nails, 80% of the nail is white with only a thin tip of normal color. In half and half nails, the split is closer to 50-50, and the distal half is darker than normal, not lighter. Same region of the body, completely different diagnosis. The difference is in precisely what you're looking at. Dolores had that 2-tone split across 3 fingers for 8 months. 2 doctors looked at it and said, age. Because nobody trained them to read this inside a 15-minute appointment, you now know what they missed. If any of your nails appear divided, pale near the base, darker toward the tip, that is a reason for a kidney function test and comprehensive metabolic panel. Not next month, this week. Now let me tell you why any of this works at all, because once you understand this, the rest of the signs will make instant sense. Beneath the hard nail plate is a thin layer of living tissue threaded with tiny capillaries, so close to the surface that what's inside them shows straight through. The color you see in your nail bed is the color of your blood right now, its oxygen level, its protein concentration, any metabolic byproduct that shouldn't be there. And the nail matrix, where your nail grows from, records every significant disruption to your body's internal systems in the structure of the nail it produces. A full nail takes 4 to 6 months to grow out. Right now on your hands, You are carrying a 6-month archive of your body's internal history. Sign number 3, Muirca's lines. Hold your hand flat under good light and look closely, not at the nail surface. Look beneath it at the tissue underneath. Do you see any white horizontal bands running parallel to the base? Now press the nail gently. Do those bands disappear under pressure? If yes, those are Muirca's lines. First described in the British Medical Journal in 1956, they signal critically low albumin, the main protein in your blood produced by your liver. When albumin drops below roughly 2.2 green per deciliter, these lines appear. Liver disease, a kidney disorder called nephrotic syndrome that leaches protein through urine, severe malnutrition, and in older adults, chemotherapy. Here's what makes Muirca's lines unique. They're reversible. When albumin comes back up, the lines disappear. That makes them not just a diagnostic signal, a monitoring tool, a visible indicator on your hand that treatment is working. White horizontal bands under the nail disappearing with pressure. That's a prompt for a simple albumin blood test, inexpensive, fast, and almost certainly not included in your last appointment. Drop a comment right now and tell me what you found so far. Describe what you're seeing, because in about 4 minutes, you're going to understand exactly what it means. Sign number 4, splinter hemorrhages. Look at your nails. Any thin, dark lines, red, brown, or black, running vertically under the nail plate like a tiny splinter of wood trapped beneath the nail. Here's the distinction most people get wrong. A splinter hemorrhage at the tip of the nail, almost always trauma. You caught your finger on something, nothing to worry about. But splinter hemorrhages at the base, appearing on multiple fingers at the same time with no injury you can remember, that is a completely different conversation. A systematic review in the International Journal of Dermatology confirmed that proximal splinter hemorrhages across multiple nails are associated with infective endocarditis, a serious infection of the heart valves in 15 to 33% of cases. The mechanism is direct. Bacteria on infected heart valves form clusters that break off, travel through the bloodstream as microscopic clots, reach the capillaries of the nail bed, rupture them. The blood spreads in a line dictated by the structure of the nail plate. Your nail just recorded something happening at your heart. Multiple proximal splinter hemorrhages, multiple fingers, no trauma, same week medical evaluation. Do not wait. Sign number 5. And this one you can test right now in 3 seconds. Press the nails of your 2 index fingers together, nail surface to nail surface at the base where the nail meets the skin. Look at the gap between them. In healthy nails, there is a small diamond-shaped window between the 2 nail bases. The nails curve gently outward. The gap forms naturally. No gap, nails pressing completely flush with no window at all. That is a positive sign for nail clubbing. The soft tissue of the fingertip has thickened and the nail has curved excessively downward over the fingertip. In early stages, it's subtle enough. You'd never notice without doing this specific test. Hippocrates described this 25 centuries ago. Lung cancer accounts for approximately 35% of adult clubbing cases, pulmonary fibrosis, congenital heart defects, liver cirrhosis, Crohn's disease. Every item on that list warrants evaluation. No window, schedule a chest X-ray and pulmonary function test at minimum. Sign number 6, pale nail beds. Press your thumbnail against one finger until it goes white. Hold it. Release. That resets the baseline. Now look at the color. A healthy nail bed is pink, clean, consistent. If your nail beds are pale, noticeably lighter than pink, approaching white or light beige, that is a clinical signal for anemia, specifically iron deficiency anemia, the most common form in adults over 60. Here's what makes this dangerous on senior population. The body compensates well. The body compensates well for moderate anemia. You might feel slightly more tired than usual. Blame it on sleep, on stress, on age, and carry moderate anemia silently for months. The nail bed doesn't compensate. It reflects exactly what's flowing through it without adjustment. Now combine that with the test from the start of this video. Press any thumbnail white, release, count. Under 2 seconds, normal. 2 seconds or more, impaired perfusion. blood isn't returning fast enough. In an older adult, that points toward peripheral arterial disease, poor cardiac output, or significant anemia. Pale nail beds plus slow capillary refill, complete blood count, and cardiovascular workup. Not a precaution, a priority. Sign number 7, and I need you to look at each nail separately. Do you see a dark stripe, brown or black, running vertically from the base of any nail to the tip, a single line lengthwise? In people with darker skin tones, vertical dark stripes on nails are common and frequently benign. The pigment-producing cells in the nail matrix can produce a stripe with no malignancy involved. This is a normal variant in many people of African, Asian, and Hispanic descent. But there is a form of melanoma, skin cancer, that develops specifically beneath the nail plate. It is called acral lentiginous melanoma. It is aggressive, and it is consistently diagnosed late because people see a dark stripe and assume it's harmless. The warning signs that require immediate action: a stripe wider than 3 mm, edges that are blurred or irregular rather than sharp and clean, color that is uneven within the stripe, darker in some places, lighter in others, and most critically, pigment that has spread beyond the nail onto the surrounding skin of the finger. That sign has a specific name in dermatology, Hutchinson's sign, and it is one of the most specific early indicators of subungual melanoma we know of. Any single one of those features, dermatologist this week, not this month, this week. Early detection is genuinely the difference between a surgical cure and a systemic life-threatening disease. Sign number 8. Yellow nails, the most common nail complaint I hear from patients over 60, and almost every patient has already decided they know the cause: fungal infection. Sometimes they're right. Fungal nail infection does produce yellowing, thickening, eventual crumbling. And in a diabetic or pre-diabetic patient, what looks like a cosmetic nuisance can cascade into something far more serious. Any break in skin around an infected nail is a bacterial entry point. In patients with impaired glucose metabolism, that pathway can lead to infection, tissue death, and in severe cases, amputation. That is not an exaggeration. That is published data from diabetic foot care research. But there is a second cause of yellow nails that almost nobody knows about, and it is far more serious: yellow nail syndrome. All 20 nails, fingers, and toes turn yellow simultaneously. They thicken dramatically. Growth slows to nearly nothing. The cuticle disappears. And at the same time, the patient develops swelling in the lower legs and chronic respiratory problems, a persistent cough, recurrent lung infections, fluid accumulating around the lungs. These three together, yellow nails, leg swelling, respiratory symptoms, form a specific clinical triad pointing to failure of the lymphatic drainage system. Yellow nail syndrome is systematically missed because physicians see the nails and treat the fungus, see the leg swelling and treat the edema, see the cough and treat the lungs as 3 separate problems. They are one problem. The nails are the signal that connects them. If you have yellow, slow-growing nails combined with any leg swelling or persistent respiratory symptoms, bring all 3 to your physician together as one connected picture. Here is your system: 5 minutes, once a month, natural light. Polish off at least 2 or 3 nails. Check the color first. Pink is normal, pale, yellow, or any dark stripe. Photograph it with the date. You're building a visual record. Check for 2-tone zones: white near the base, darker toward the tip. Kidney finding, report it. Press the nail bed and look for horizontal white bands that disappear under pressure. Muirche's lines. Get your albumin checked. Check the base of each nail for dark vertical lines across multiple fingers with no injury history. Same week evaluation. Press your index fingers together, nail to nail. Look for the diamond gap, no gap, pulmonary and cardiac workup. Press any thumbnail white over 2 seconds. Check every nail for a dark vertical stripe, width, edges, color consistency, spreading onto surrounding skin. Any warning sign, dermatologist this week. And yellow thickened nails plus leg swelling plus respiratory symptoms, those 3 go to your physician together as a single connected complaint. 5 minutes, once a month, no equipment, no appointment, no cost. Dolores started the kidney disease protocol her nephrologist prescribed: medication to manage blood pressure and reduce protein loss, dietary changes to protect kidney function, regular monitoring. 18 months later, her kidney function has stabilized. She has not progressed to stage 3. Her nephrologist told her at her last appointment that catching it at stage 2 gave her a genuinely meaningful chance at avoiding dialysis entirely. Dolores found it because she knew what she was looking at. She looked at her nails. She trusted what she saw, and she kept asking until someone listened. Your body is not hiding from you. It is communicating with you continuously at your fingertips, in plain sight every single day. The system you rely on for your healthcare is not designed to read those signals at a standard appointment. That gap is real and it costs lives, but you now know how to read them yourself. I'm Dr. Michael Kent. If you found something today, comment checked below. I want to know how many people in this community are actually using this. And if someone in your life is over 60, send them this video, not because it's interesting, because their nails may be telling them something right now that nobody else is going to read. Subscribe, because in my next video, I'm going to show you the single most underused blood test in senior medicine. A test most physicians won't order unless you specifically ask for it, that can detect cardiovascular risk a full decade before symptoms appear. You are going to want to see that. This video is for educational purposes only and does not constitute medical advice. Any findings during self-examination should be discussed with a qualified healthcare provider.